So we are with Gabriel Cohen, the Chief Marketing Officer of Monigle. Hi, Gabriel.
Hi.
I guess the first question that we wanted to start with really is sort of taking a broader look at the landscape, and what are the kind of key influences that you see affecting the landscape for healthcare?
I think that the thing that we're most focused on is the consumerization of healthcare. So let's kind of break that down a little bit. The way that care has been delivered traditionally has been typically in a hospital setting. You look across the whole US landscape, there's a huge expansion towards finding other models of care delivery, whether that's urgent care, whether that's different outpatient facilities, not to mention telemedicine and other remote ways of dealing with that. And so what that does is it forces these healthcare institutions to stop just thinking about themselves as hospitals, as being the place where service is delivered, to all these different places, which means then the creation of this system of healthcare. And so why does that force us to have to think about as consumers? Because we're not just patients. We want things to be coordinated and connected in the same way that if you go to a Starbucks in one location and then you go another, you want that experience to feel familiar, you want it to feel connected. You're using your Starbucks app. And I think that then speaks more broadly as to why we're, even in healthcare, moving the nomenclature away from patients to consumers, because as a human, I don't all of a sudden see myself as a patient when I go into a healthcare setting. I might be going to a healthcare appointment, but I've ordered the Uber on an app, and I've picked up my Starbucks on an app, and maybe while I'm away, I'm getting a notification I've had an Amazon delivered, and I expect my healthcare experience to be seamless and frictionless.
So thinking about that kind of Uberization, if you will, of the healthcare space, what's the implication then on brands and how they're sort of structured and leveraged through an organization?
I think one of the really interesting things that we're seeing is bringing the advent of marketing leaders who come from outside of healthcare into healthcare. It's always been typical in healthcare that you have to understand the industry, and healthcare and marketing within the healthcare organization has very much in the past been a comms function. And the joke among a lot of people is it's the t-shirt and cups department, right? The nurses want to do something, it's like, oh, they want a t-shirt with the logo on. So now you've got CMOs coming in who maybe were brought up at Unilever and Procter & Gamble or other consumer goods companies coming in, and they're elevating the discipline. And because they're I think they're much greater experts in the discipline, they're gaining more traction internally and oftentimes more influence. One of the things that then becomes really interesting, you start to see what I call the potpourri of titles within a healthcare institution. So someone who comes in as a chief marketing officer, now 6 months later is responsible for experience, so becomes chief marketing and experience officer. We have a customer who's the chief marketing, experience and customer officer. So not every healthcare institution is there. A lot is still struggling with trying to make the case for marketing, brand and experience, but we're starting to see more and more institutions where brand and marketing is having more and more of an influence, and the discipline is evolving.
Which is counter, I would argue, to many of the other kind of marketing organizations in the world where we see marketing having somewhat less of an influence, I think.
The last thing I'd leave you with is it's not just the urgency and immediacy, it's who are going to be the patients of the future. It's Gen Z, right? In 4 years' time, at least in the US, Gen Z is going to be 30% of the workforce. Gen Z, if you make it hard for them to book an appointment, they're just going to go and seek treatment on AI. In our Humanizing Brands research report, where we're able to break down, we spoke to 26,000 people and a lot of those are Gen Z. So we broke out the data, and the attitudes of Gen Z compared to others is drastically differently. They don't have, they're more engaged in being proactive around their own health, but they are impatient. They will not tolerate a poor experience on what they think should be the fundamentals and basics. They're more likely to turn to AI. So we have to start to think about the needs of this group if we're going to be able to stay competitive. But if I really then go and believe in your product, I'm actually going to invest in it. So there are even some healthcare institutes that are creating these venture funds.
So to wrap up, there's a huge opportunity really for a more consumer-orientated approach to the brand building as it relates to AMCs. Is there one thing that you would leave us with as we finish?
I don't. It's not even on. I think it's moved beyond being an opportunity. It's a case of survival. It's moved from being wouldn't that be nice? The urgency is now so much so that it's actually a case of for survival, and I think this is going to become a tipping point.
Thank you so much. Thank you so much.